I was around 13 or 14 when I first experienced severe anxiety. I did put a lot of self-worth into my grades, how well I did at school. I felt my self-worth wasn't enough because a lot of people would treat me like I wasn't on par or intelligent, and I just felt so down about that.
17-year-old Ebony Urquhart started experiencing panic attacks around 3 years ago.
I felt like my chest tightening, my heart racing, difficulty breathing. So it's harder to think, it's harder to put in those coping strategies like breathing.
Living in rural central Queensland, the options for treatment were minimal.
We're looking at 12 months before we could get any professional help for her at all. So when we went to the GP, he did suggest that we go down the path of some anti-anxiety medication, which wasn't ideal. It's not the path I would have wanted to take for her, but it was an option to start with.
When the pandemic arrived, Ebony's mental health deteriorated and her mother decided medication was not enough.
We first were offered a place at a private psychologist. So our sessions were around the $200 mark per session. We did get some Medicare rebate for that. Affordability is a massive issue.
It did have a major effect on my family. Mum was constantly stressed. She was worried because she didn't know what to do. Like, there's no simple answer.
1 in 3 psychologists are so busy they've closed their books to new clients, according to a survey by the Australian Psychological Society. That's compared to 1 in 100 before the pandemic.
I wasn't surprised. Working with psychologists all the time, I know what's going on in the field. There's 27% more young people and adolescents that are presenting with issues of anxiety and depression.
Well, we know if children can't get treatment early, they're likely to go on and have more problems, more severe problems, and come into a sort of downward spiral of increasing anxiety, which can then merge into depression, and in worst case scenarios can merge into suicidal ideation and self-harm. Tell me, why have you come today? What's been going on for you?
Professor Harriet Hiscock is a paediatrician at the Murdoch Children's Research Institute.
We've got a chronic workforce shortage. That's been made worse by the pandemic, and we're exhausted. We can't keep going like this, and some of them have actually started to pull back on their hours, which further exacerbates the problem.
In the regional Victorian town of Ararat, clinical psychologist Carly McInnes cannot keep up with demand.
I haven't been able to open my books, for a couple of years, which is just heartbreaking. At the end of the week, I would have 10 messages on my phone of parents crying saying, "Can you please see my child?" And I could only do so much.
This is just about the last of the stuff.
She's teamed up with former school principal Tammy Meehan to create the One Red Tree Resource Centre.
We have just moved in. We have got bare bones.
In addition to creating a new wellbeing hub at the old Ararat train station building, the organisation is also coordinating work placements for final year psychology students at primary schools in the remote Wimmera Mallee region.
That was where the collaboration with Federation University came into play, that they had a need that they couldn't find enough placements, and we were saying we want to get some resources into the community. Today we've travelled up from Ararat to Concanjala with Miles, the student who's going to be working here, the provisional psychologist.
As a result, university students like Miles get supervised work experience while vulnerable children receive free counselling.
And how's the friendship group going? You got many friends here?
Yes.
Yeah?
So far, only 5 schools are part of the program, but there's hope more could join soon.
A program like this enables children to succeed and to feel a part of something, and to feel that belonging, and to feel mentally healthy, to be able to go about their lives.
Despite 28% of the population living in either rural or remote Australia, 8 out of 10 psychologists live in major cities.
There's nowhere for them to complete their work placements. Doctors go and work in hospitals, but there isn't an equivalent for psychologists. So again, there's an even tighter bottleneck. So what comes out at the end is a small drip feed of psychologists when there could be a flow of a new workforce.
In Queensland, Ebony is looking ahead with optimism and has just started her final year of school.
I feel like going outdoors does help me a lot. It's still hard, every day is hard, but I've learnt to live with what I have. If you're suffering such symptoms like I am, or anything that can be related to anxiety, depression, mental health, please reach out. It is scary, it is hard, but it's something you need to do.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.